Uh, we're in crazy times right now. First off, how are you doing right now, and how's life for the Mattins?
A little different than normal, but otherwise doing very well, Zeb. Nice to talk with you.
Yeah, good to talk to you too, man. But obviously the circumstances are pretty tough right now. First off, how many kids do you have? How many boys do you have? How many Mattin boys are there?
I have four boys.
Four
Four boys.
boys.
Yep.
We got Drew,
Yep. Drew's
Cole.
20. Drew's third year up at Michigan, University of Michigan. Cole's just finishing up his freshman year up at Michigan. Zach just is a junior right now, and Adam is a seventh grader.
Okay, so three of the four boys. He's a seventh grader. He's in middle school. He hasn't had a chance to wrestle, but three of the four boys and yourself have been state champs for Delta over there in Northwest Ohio. Correct?
Correct.
Okay, you were actually Delta's first state champ. Zach's the last, right?
Yeah, so yes, I was the first state champ by about an hour and a half. So it was a benefit of being a lightweight compared to the big boy.
Who was it? Robson Tobin?
Yeah, Robson Tobin was about an hour and a half later.
Okay, so yeah, the two great families, the big family names obviously out in Delta are Sintobin and Mattin. I mean, there's more. There's more. How many other siblings have won state titles at Delta besides? Well, those are two siblings for Rob and Adam have won, and then Troy won for Sintobins. How
Yep.
many? How many of them?
Troy's a cousin, and then I think that's it. I don't think there's any other siblings that have won multiple state titles or state titles as family in Delta.
Okay, so those are the two big families I like to, and people I really like actually. I like Adam Sintobin and Rob, good guys.
Great family.
Great family. So okay, um, obviously you are a doctor. Where do you work? What is your job title and where are you working? Where are you at right now?
Sure. I'm an emergency medicine physician, and I work primarily at Toledo Hospital. Our group covers 7 hospitals within the Northwest Ohio area, and we work also up in Monroe, Michigan. I'm the medical director at Toledo Hospital Emergency Department. So I work half clinical and half administrative. So that's kind of my job.
Okay, and as you know, as I was talking to you earlier off camera, you haven't been as swamped as I thought you would be because right now you took this time off for what you and I thought two events you and I go to. You as a dad and a fan, I as a media guy. Last week at state tournament, Zach won his district at Napoleon and was on track to win another state title. I felt like, and then you were heading out to Minneapolis with your boys, right?
Yeah, so this is kind of for wrestling fans. This is kind of like the Super Bowl time of year. So last weekend we figured we'd be at the high school state tournament, and then this weekend Adam had his junior high state tournament, and we obviously love to go to the Minneapolis and see the NCAA. So we're trying to figure out logistically how to fit that all in, and then come to find out I don't attend any of that. So
That's crazy, man. And we're gonna obviously get into the medical end of it, but I got to talk wrestling with you, right? Like that's a big part of what we do here. But how did Cole do at Big Tens? He was 141 pounds for University of Michigan this year. How did Cole do at Big Tens? Because here's the crazy thing. I interviewed Zach after Napoleon after he won. He had a fall in the finals. You weren't there, and I was like, "Where's your dad?" And if, in a typical Mike Matt and Road Warrior format, you left Friday night from Napoleon, probably went to Detroit, and then you flew to probably either Newark or wherever you flew. What was your route? And you went and watched the Big Tens from the district, right?
sure. So the plan was to get Zach through the semifinals at district, and so I stayed through the semis at districts, and he was
Oh, you left
fortunate.
Saturday morning.
Oh yeah, I went Saturday morning. He wrestled at 11:15. I jumped in the car, got up to Detroit around 1. Caught a flight at 2 o'clock from Detroit to LaGuardia. Then rented a car from LaGuardia, drove to Rutgers. Cole wrestled at 6:30. I think I arrived at 6:15 at Rutgers, got the ticket and sat down. He gave me a quick hug and ran on the mat. So it was a busy weekend.
So you do this a lot, though. I don't think a lot of people understand. You actually do this. Like, that is I call that a very Mike Mattin thing. saving lives, road wiring, air wire, whatever you do. Like, you do a lot, man. It's kind of crazy. We'll get into the life saving, but how did Cole do at the Big Ten?
Well, he didn't do quite as well as he wanted to. He lost his first match to Phileas from Purdue and dropped him in the consies. And he had his basically his placement match was then to wrestle the Duncan boy from Illinois, who's a three-time national qualifier. Wrestled great, tied up the match with like 6 seconds left, and then gave up the reversal, kind of at the buzzer to not place. So in the Big Ten, they had eight allocations. And they do once all the kids are out. He ended up winning 2 matches the next day to finish 9th place as the alternate. But so he was just out of qualifying, and which was, I know, very heartbreaking for him. But definitely a learning experience for a true freshman season. So.
And in the Big Ten, obviously, with how the dual schedule goes, that Friday Sunday thing. I mean, he learned a lot this year that obviously Drew already knows about the Big Ten and the Friday Sunday schedule. It is a grind, man. It is a grind. January and February in the Big Ten is not for the faint of heart, and literally only under 100 people do it super effectively, right? Like, if you think about it, it's such a grind. You get chewed up and spit out, and for a true freshman to do that and then to be there to qualify at the end is pretty good. So, do you want to say hi real quick? Come on. No? Okay. Ferdinand just ran in the room like a wild feral animal and then ran out. Okay.
Really?
Yeah, I know you know. You already gave me the tip. You said as soon as you start getting outnumbered, you're in trouble, Zeb. So we stopped. We're done at 2 here. We're not going to go for the outnumbering situation. Where you're 4 on 2. You're 4 on 2 and you get outnumbered, then that's when the kids really start to rule the roost a little bit, Mike. I know.
Yeah, I know. You think you're busy when they're young with the 4, and then you realize that when they're older and you got college and high school and junior high, and you want to be there as a good parent and be supportive. It definitely challenges the planning and the navigating the travel and such. But it's all good. I wouldn't trade it for anything.
Okay, Drew redshirted this year. Drew Mattin redshirted this year for Michigan. And they're coming back with it's a gold or a silver trophy team, in my opinion. It's an unbelievable team. 2 Olympians are going to be on the team next year. They're really loading up for a title run next year at Michigan. I don't think there's any doubt about it.
They have an amazing, talented team and a lot of potential and a lot of proven guys. And I think there's a lot of excitement about, the team next year. And I know that Coach Bourmet, great leader, great program. They're doing all the right things. And so I know that they're itching to get back, all the programs itching to get back to work and, get back at it.
Okay. So was Zach undefeated this year?
He was.
Yeah, he won the Medina. He had a crazy match with Crosby where he got thrown on his dome and somehow won the match on a ride in the 3rd period. So he had some tough waters to navigate to be undefeated this year. He went to some tough tournaments. Maumee Bay won Maumee Bay, beat Moon and Maumee Bay in a barn burner. The number 1 guy in Division I. So he had a great season. How did Adam do?
Adam had a great year, so he was undefeated on the year and had a nice year, been wrestling well, and kind of making gains the way I'd hoped he'd be. And he's getting that itch to be hopefully wants to be special, and he's starting to act like it and behave like it and do the things you need to do to be special behind the scenes, and which is good. So I think that it was nice that he put in the extra work this year, and the results kind of seem to parlay into that. So it's funny how when you work harder, you get better results.
I actually know how Adam feels. I'm the youngest of 4 boys, and my 3 older brothers were state champs, and then I wasn't a state champ. So that was obviously tough, for a couple years. But when I went into college and got into college, and I was able to have I don't know. I had a college career. I don't know if it was super successful, but I had a college career and placed in the Mid-American Conference a couple times. Was alternate for the NCAA tournament, essentially in what position Cole's in right now. It's tough, but life goes on. Life goes on. Like a lot of these kids, life's gonna go on. I think we're in this extraordinary situation, Mike, What do you say to Zach Mattin right now? What do you say to him? Because they're having the press conference today. The OHSAA is going to have the press conference where they're going to cancel, right?
Absolutely. Yeah,
I mean, they have to, and that's what we're going to talk about next. What do you say to your boys about this? What do you say to, is Adam going to have his OEC tournament? We don't know that, right? Like, but the OHSAA is probably canceled, right?
Yeah. So it was last week when I got that on Thursday, I heard, I saw it on the social media that they were canceling it, and I didn't want Zach to hear that on his own, so I drove up to the school to have that conversation, and just because I didn't want him to hear it, because all the kids work really hard, so to break that to him was a pretty emotional time for him, and it was pretty hard. He just kept asking, why? I've done everything right, and that's I've done the extra work. I'm ready to roll. I deserve a chance to repeat a state champ, and obviously you don't have the answers, right? As a dad, you felt terrible for him because the work that he put in, and but so yeah, it was a tough conversation that I'm sure a lot of kids, the emotions were raw, and it was a rough afternoon.
So you got to assure him, hey, man, this isn't your fault. You didn't do anything wrong. And
right.
It's for all the athletes, though. It's the 330 right. NCAA athletes. It's the, Pete's. We got 16 at 14 weight classes times 3 divisions. I mean,
yeah.
There's
so.
Yeah, hundreds of kids. I mean, it's mind-blowing to think about it. So, let's just talk about the meat and potatoes of what I want to talk to you about, though. Like, this is a serious health risk. COVID-19 is a respiratory, it's a virus, respiratory infection, correct?
Yeah, it's part of the coronavirus. It's one of the coronaviruses, yes.
Okay. And this particular one originated in Wuhan, China, correct?
Yes.
And they're saying it was the wet markets, right, where they have live animals.
Well, that's what they're kind of attributing it to. I mean, basically, it's a novel virus, and what they mean by that, it's a virus that has not been, we haven't been exposed to before, and that's what's causing the problems. We've not seen it; it's new, and so that's kind of why it's wreaking havoc. Because nobody has any antibodies, which is basically the ability to fight that virus. So your body, it's new to everybody.
So this is almost like Christopher Columbus and the Spaniards coming over in 1492, and that is like essentially they were bringing things with them from the Eastern Hemisphere that Native Americans had never seen, and what ravaged Native American cultures is. Listen, I want to feel like I know something here. That's what ravaged Native American cultures. They had no immunities to the smallpox, influenza, anything that the Asians, the Europeans, or the Africans brought with them to North and South America, right? That's essentially what's happening.
Yeah, great analogy.
So that's the deal. Okay, Ferdinand, good job. We've got that in the picture. All right, here, you want to sit in here for a little bit? Okay. So we don't have any immunities to it right now. Our big so everybody is at risk. But the biggest risk factor and the people that we're really trying to save would be your 65 and olders because their immune systems would be weaker. Am I correct in that?
Well, yeah. I mean, as we get more advanced in age, you're definitely have more comorbidities, meaning you have other medical issues going on, and you're not able to fight it. It does appear that this virus per se, while it's transmitted to everybody, it seems to be hitting our elderly population the hardest. So when you look at the mortality rates, meaning who dies, who gets really sick, anybody more than 60 years old, it seems like the numbers show that that's going up significantly, at least when you look in Italy and in Wuhan, in China, what they dealt with.
And we have to go off their models, and the problem with going off their models is they're not big on sharing information.
Yeah. I mean, China isn't, obviously is open. There's been a lot of data shared with Italy, and now that, in Washington, we're learning a lot, and we're getting a lot of information, what worked, what didn't work, what things, a lot of this is you don't know what you don't know. And so, when more people go through it, you can kind of get prepared for some of the things you don't know you need to be ready for.
I want to talk about it. Like, I like to learn things from you. So I like to have you tell me things. It feels like I have like a layman's grip on it. I feel is what I have, like, is basically a layman's grip on it. Um, the quarantine and the self quarantine and the social distancing. Tell me about the curve and flattening the curve, and they're basically telling us four models right now. They're showing us four basic curve models, right? They're showing the massive Everest spike model curve that they're showing us, and they're showing us three other scenarios. Tell us about the curves that they're presenting to us and how we reduce the curve. I saw you on a Twitter post, all gloved up, glasses, face shield, everything. You were covered. Everything was covered. Tell us about flattening the curve and what the curve is.
Sure. So what you'd like to think about it is, if we did nothing and we just, went about our daily lives, then we'd have a massive spike with people getting infected. And if you look at the data, and again, I'm by no means an absolute expert on this. So take this with a grain of salt. I'm educated on it. I feel comfortable talking about it. But so you get a massive number of people get infected. About 80%. So 80 out of 100 are going to do just fine. They're going to walk around. They have a cold. They have mild symptoms. Then you have about 15% that you would describe as get sick. You'd say, like when you get the flu, okay, you feel terrible, you're kind of down and out. And then you have about 4% that get really sick. And those are the people that get, life support and or won't make it. So you would have a massive influx of that. It would just spike, and it would overwhelm the hospital system, because the hospital system, we only have so many supplies. When you think of ventilators, when you think of just supplies in general, beds, rooms. And so we operate, all hospitals operate at a pretty full level. And so they could not handle the ability to handle the massive volume of patients that would be coming in. So the goal of that social distancing and quarantining is to help and lengthen the time that we may be exposed to, or that we have the virus out there, but the numbers of sick patients that we're developing are low enough that we can keep them, we can get them better, get them out of the hospital, and then we take the next wave of patients that are sick. And so that's why it's important to flatten that curve. So you want the same number of people are going to get sick, but we can take care of them more because we have the capacity over time to deal with them, but we just don't have the capacity to deal with them all at the same time.
So Terrell Delagnev said to me, he goes, if you ask 330 of those athletes, he said probably 300 of them are going to want to go, and they're going to go wrestle at the NCAA tournament. We get that, right? With no fans, and they could have been in the gigantic arena. Would those effects been cataclysmic, do you think? If you got no fans, massive arena, just the kids wrestle.
Yeah, I mean, obviously a lot of factors at play there. I think that they did the right thing. As painful as that is for me, what type of fan I am for the sport and then for the kids. And I know exactly what the people are putting into this, and the coaches and the programs, and how important it is to them. But I do think it's the right thing to do, to see, to hear some of the stories, what they're dealing with in Italy, and to hear what they're dealing with out in Washington. And it's a very scary time, and it was the right thing to do. I'm fully convinced of that now. As painful as that is to say, it's the right thing to do.
Okay, so say we do this, we do nothing, we go here. Ohio's been the model for it, by the way. Mike DeWine he's been at the forefront of this. Love him or hate him, I don't care about that. He's the model for all the other states and what people are doing. So we have the 40,000 fans. We do the state tournament. Are those effects cataclysmic? What's your projection there? We go business as usual. Do you feel like, how bad would that have been?
The potential is tremendous. I mean, I think that, we don't have the ability to test at the level we want to, we being the United States. And so you have all these people that are out there that definitely have COVID-19 right now. There's just there's hundreds, if not millions of people that have it. And then if you put them all, bring them from all over the country, put them in the same unit and then spread out, then it's then everybody they get, and then they get in contact with their family and friends, and it just spreads. Those models in the Washington Post were very telling and a very good representation. So yes, I think that the potential was there. Two of my doctors went to an ER conference in New York City. One of those. Six of those doctors have already tested positive from that mild conference. And, so it's a real thing that when you bring people from across the country together and then they start spreading it and then they go back to where they're at, then it just multiplies over and over again.
Mike, what would your medical advice to Tom Miller, my dad? My dad has a pacemaker. My dad has type 2 diabetes. He's actually in amazing shape for all these horrible things I'm telling you about him. What would you have said to him? He's 71. What would you have said to him about going to the Ohio State tournament? What would you have said to him? So it was just the four for each wrestler. He was going to be one of my nephew Wyatt. He was going to be one of his four. What would you have said to him?
Yeah, I would have said, I talked to your dad actually at Maumee Bay. I believe I saw him there. I saw him recently, one of the tournaments. Can't remember which one. But I tell him, he needs to stay at home. And he needs to not go out. He needs to not go to the grocery store. He needs to rely on his family and friends to do that. I think he needs to not go to church. And these are the same conversations that I had with my mother-in-law, with my parents, with my grandparents. And, I stopped over my grandparents, stayed more than 6 feet away, talked to them about, because they went to church last week, and I kind of gave them grief over that. And, tried to explain to them why it's so real and what needs to be done, and volunteered our services to go get them groceries, drop it off on their front porch, and just need to stay inside and stay away from everybody for, 14 days at minimum and go from there.
What is the incubation period for it, and what are we seeing? Because I know that it's novel, it's new. That's what that means. It's almost like a novelty. That I think that's actually what you're doing with when you call it novel, right?
Yeah.
Because it's new. It's new. We don't know anything about it, but 100 times more than the average Joe Bag of Donuts knows. You know a lot, Mike. What is our incubation period? What are some things that maybe our media is not telling us that we don't know about this?
Well, I mean, I think, with it being novel, there's a lot of things we don't know in general. What it appears that we are contagious before we have symptoms, which is not good, right? When you're spreading it when you feel fine. And even after you recover from your symptoms, it appears that you're still shedding virus. And so they're not too sure of the time frame, but they feel confident from everything I've read and talked to that you are spreading it from, you can get symptoms is from 2 days after exposure to, over 14 to 20 days later. So there's a long period of time where you can share and spread the disease.
Okay, what is your projections right now? What do you guys see as far as projections when you look at I'm hearing July, August, man. I'm hearing we're going to be in this situation till July, August. Would you say that's an extreme model? What are you guys talking about right now? What are your kind of the models you guys are being shared with?
Yeah, to be honest with you, Zab, we're working day to day, right? We're working through problems in a moment by moment basis. And I can tell you that, I'm sure that my hospital system is no different than any hospital system across the state of Ohio and across the country. That, you're not planning for 3 months or 6 months. You're literally trying to get things up and running for the next day. Things are changing. The amount of energy and resources that are being put towards this at the system level, I think would be, if everybody knew the amount of time and energy that people are in the hospital system or healthcare system is putting towards this, they'd be very impressed. People are taking this extraordinarily serious. And to be honest, we haven't even thought 3 months out or 6 months out. We're thinking literally, today, what can we do today to not only protect our patients but we also need to think we need to protect our healthcare workers, because without our healthcare workers, we can't take care of our patients. And so you're trying to get the message out on what people can do to help, because I think we all have a role, and that's kind of where we're at. So I do think it's probably going to be a long time. I think that they're working hard trying to develop vaccines. They're working hard on trials for treatment. However, viral treatment has never been that beneficial, but what we can do, that little things we can do to help once you do get infected. But ultimately, the answer is going to be a vaccine, and that's probably well over a year out still.
Wow, we're over a year out for a vaccine, you think?
Well, I think they're developed. From what I heard, I read an article today that I think that there are they're doing tests on people. People have been injected. There are some people that have received a vaccine already. But like any vaccine that you're going to give to millions and millions of people, you need to do the research to look at the long-term ramifications of that vaccine. So I do know they're developed. I do know they've been given to humans. And I think they're tracking them and monitoring it and stuff. And that's way above my pay grade as far as where they're at with that. But yeah, it's going to be a long time.
Are the stores and things like that madness? You're in a small town, right? And I'm in an urban area, suburban area of Cleveland. Is it madness over there at Delta? Do you guys have? I don't know. Do you have a grocery store in town? Is it bare? What's it like there?
Yeah, I mean, we do have a grocery store. It's a small town, but we do have one grocery store. It's like anywhere. Some things you just can't get, right? The toilet papers of the world, they're very hard to get.
What is that? What is that? Tell me what that is. Do you know what that is? I don't know what that is.
I have no idea. So no clue about that. But so yeah, the grocery stores have been doing a great job, and those workers, I would say we went one day and there was hardly any meat. Went the next day, it was full. So we've still been able to get supplies as we need it. I think that a lot of people are very nervous and very scared, which is understandable. But you need to keep things in perspective, and we can't panic, right? You can't panic. We just have to, can't buy, 10,000 pounds of meat. You just, buy what you need for a couple of weeks and go from there.
Have you seen any of the videos circulating on the internet of like they're interviewing people on the beaches who like, oh, this is ruining our spring break. We're still partying. Have you seen any of those videos?
I did. I saw a couple of those. And, I try to keep things in perspective, right? When I was 19, 20 years old, I didn't have perspective in life, and I didn't experience the things that I've done now as a 47-year-old man in the healthcare world. So I don't really take it personal, but it makes me sad that the message isn't quite out there as much as we want it to be. And I think young people in general feel they're invincible. And, that to alter that mindset it takes time, and it takes some real conversations. And so, yeah, it's disappointing, but I think that, that slowly that message I think the vast majority of people understand and are getting the message out and understanding that message, which is, everybody's got a job to do.
Have you let the Mattin boys know they are not invincible? Have you let them know? Do they know that?
Well, yes, they definitely know that. So, Drew and Cole, they were up in Ann Arbor, and they got home, and I said, well, you guys, they're like, well, when can we go back? And I said, what do you mean when you go back? You're not going back until we, and they said, well, why? And I said, because, they're typical 19, 20-year-olds. They want to hang out with their friends that are still in Ann Arbor and such. So yeah, we've had some real conversations here, and I think they get it more than most, right? They see what I do for a living and the consequences of, they don't want me to get sick, and I don't think they want anybody to get sick. So maybe they understand it a little better than most.
So they have a pretty good grip on it, and they're intelligent, and they're pre-medicine. Two of them are pre-medicine, right? Pre-dental, it's medicine to me. I'm sorry.
Yeah, Cole wants to be an orthodontist, and Drew's in pre-med.
Mike, I was raised by an iron worker who was raised by an iron worker. So you got to understand where I'm coming from here when I say these things to you. They didn't know a whole lot about anything when it came to the medical field. Rub some dirt on it and get tougher, I think, was a lot of the stuff that they would tell us. You know what I mean? Like, so we're talking, very different. Like we wouldn't have known anything about this. We would have had no clue, and we'd have been at the mercy of a good person like you telling us, hey, this is for real. This is that you need to understand this is for real. Um, are we in the lockdown? Are we going to lock things down? Are you going to be one of the only people moving? You truck drivers? Are we at that level? I think we're at that level, aren't we?
Well, I'm definitely not in the know, but it wouldn't surprise me if we get to that lockdown level for a couple of weeks. I wouldn't, I would say everything DeWine has been at the forefront on making some really hard decisions, but if those decisions save lives, and do what we think they're going to do, and keep the hospitals open and not from keep their head above water, then so yes, I think the answer is ultimately going to be, there's going to be some version of that. We're already there. Are they going to shut down flights? Are they going to shut down everything? It would not surprise me at all.
If you look at Italy, you look at China. First off, let's just talk China. The way that China's 5-1 to us. They're 1.4 billion people. We're 329 million. 320. We're one fifth of them, right? We're one fifth essentially. Most of them live in apartments with shared air circulation systems. But they don't have any civil liberties. They don't have due process of the law. It's very simple for them to lock people down and tell people, hey, you're not doing this. Americans we don't operate like that. If you've seen some of the spring break footage where kids are like, we're not going to get this. Even if we do, we'll be sick for a little bit. We need to party through this. Americans are a different beast from Italians and the Chinese. We're very different. Do you think that that's something that's almost our enemy? We're really free. We're really, 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 really free. And nobody's ever seen this. My dad's never seen this. You know what I mean? His dad lived through World War II, my Papa Ferd. But we've never seen this, and it's unprecedented. Are we our own worst enemy when it comes to our freedoms that we have almost?
That's a great question, Zeb. And I would say that we are, but I think we have a lot of smart people. And I think that if we keep getting the message out and we keep holding people accountable for their actions, then I think that I'm confident. What I see, our volume in the emergency department, the message has been out there, right? Don't come to the emergency department unless you absolutely need it. People are listening. Our volumes are actually down overall in the emergency departments, and that's a great thing. It allows us to take care of the patients that need us. It allows us to decrease the exposure. So I've seen a lot of great collaboration. I've seen so that freedom is a bad thing, but there's some positives as well. We're educated. I think that we have the ability to, we have that free access to all the information. And, so I'm optimistic more than pessimistic that we can make some real positive, changes in behavior. And I think that if we all hold each other accountable for our own actions and for what the appropriate actions are, then I think that message gets out there a little bit sooner, and we can be okay.
Give me your top 5, top 3. Give me a list of what people absolutely need to be doing right now. You've reiterated it in the interview several times, but right now, people need to hear things 2 and 3, 4, 5 times before they memorize something. What are the top things that Dr. Mike Mattin says what are the essential things we must do right now to get through this? And what do people have to do to stay healthy and safe?
Yeah, great question. So number one, if you're over 60, you literally need to shut it down completely. Get people to go get you things. Don't be going to church. Don't be going to meetings. Just stay inside and stay healthy. What you can do on a daily level is wash your hands repeatedly. Don't shake hands. There's multiple studies that show that shaking hands is just a bad idea. I think that, so repeatedly wipe down things in your house, door handles, surfaces much more than you typically would. Avoid going out as much as possible. If you do need to go out in non-busy times. So when you're going to the grocery store, go in the early morning or late at night. So you're going to avoid people as much as you can. And if you are around people, keep that 6 feet, keep that 6 feet apart from each other. And that's about it. So stay home, wash your hand, stay away from people. If you do have to go out, try to stay with greater than 6 feet away from people.
Is it a good strategy to act like you already have it? Is that a good strategy? Like, you don't want to
Yeah,
spread it.
yeah, that's kind of one of the biggest things I wish we had is, from the testing perspective, I think people, when we look in the mirror and talk about this, when you look in the mirror and you wake up in the morning, you look at the mirror and say, I don't have it, right? So maybe I don't need to follow these rules. If we have the ability to test people and tell them that they're positive, I think it hits home a lot more real. And so that I'm looking forward to the day when we can have what we call point of care testing. And point of care meaning I can order it in the emergency department. I draw a little bit of blood. I run the test literally in the emergency department and get you those answers. And I know that's out there. It's coming. It's not coming as fast as everybody would like it, but I know people are working really hard to make it happen. So yeah.
What is a typical conversation like on a daily basis with the Mattins? You guys are spending tons of time with one another right now. I'm spending tons of time with my kids right now. We're doing a lot of hiking. I own property. I know you own property. I'm cutting trees. I'm feeding the fire. I'm doing all types of stuff. We're hiking. What's the typical day like in the Mattin house right now? What are these conversations like? You talking about the news a lot. You obviously want to keep them you want to keep them in the know, but you don't want to keep them paranoid and scared, right? Like, what are your daily conversations like with your sons and your wife?
Yeah, so try not to watch a lot of news, to be honest with you. I find it a little bit depressing, and I don't think it really adds value. I think it just creates more panic a lot of times, and at least my own personal opinion. But you want to be in the know, but not be in the know too much, and you're not sure what's real and what's not real. But for me, obviously my youngest two are on spring break. So the older two, they're trying to keep their life as normal as possible. They're having their tutors online. They're having their classes online. So trying to operate as business as usual. Got up, I went for a run this morning, by myself, and trying to do those kind of things, and just trying to keep people busy, right? We've got a nice project list that we're trying to get through, just to kind of operate as business as usual, but we're staying home. So
You're off right now, but you're not off at all.
no, I have all the meetings.
Oh
Meetings this
man.
morning home, and I have meetings this afternoon and calls. We've totally redesigned our emergency department so we can separate out any patient that is. We can cohort them in an area that keeps them separate from everybody else. We have a separate waiting room for these type of patients, and so again, the amount of energy and resources, and it makes me proud to be a healthcare provider, because these people are working so hard and to make people safe and to do the right thing. And it's been it's a super scary time, but watching how at least the emergency department and the hospital has managed this, I don't sense fear from the healthcare workers, other than I think they probably are afraid of a little bit of infecting their family, right? Their family didn't sign up for this. They did. And but the amount of collaboration and teamwork and stuff has been really great to see.
Okay. So as soon as this all breaks, and hopefully it breaks, and I think you and I are both anticipating a break in the next 3 to 6 months, right? It'll be summertime. Mike Mattin's a maniac. Will we see you try and go anywhere like this? Or, I got my Denali mug. I've been there.
Yeah, so it's funny. Just applied to go with my dad and all my boys. Going to go hike Mount Whitney out west. So we just applied for the permit for that. So hopefully, this fall, or I guess it's in August, we're going to plan on going and trying to hike Mount Whitney, and then trying to set up a guys weekend where we can go hike the Devil's Trail in New York, part of the Appalachian Trail. I heard it's a 25-mile rough hike that we'd like to do. So those are kind of on the bucket list for this summer.
That Whitney hike, first off, Whitney's the highest mountain in the lower 48.
Yep.
Whitney, my cousin Don just did it, and I gave him one of my headlamps, and I have a headlamp, and it becomes a lantern, actually. It'll light illuminate a large area. He did it, and he had no problem. But obviously it's a high 14, but I guess it's real gradual, is what I've heard about Whitney.
My dad did it actually last year on his own, and he wants to go back and take us and the boys. So we're going to try to do that. I've heard it's doable in a day. So get up early.
Whitney's doable in a day. I didn't know that. Is it doable? I know that you maniacs will do it in a day, but like for regular people, is it doable in a day?
Yeah, I think it's a 12 or 16-hour day. So it's a
That's
long
not
day.
bad,
Get it
actually.
to a-
Yeah, because I've done Adams. I've done the one in New Hampshire, Mount Washington, which is easy. It's like a 6,000 footer, and then St. Helens a bunch of times. Yeah, I've done a couple, and then Ian and I did all the Burroughs Mountains that are around one in Washington, Rainier.
Yeah.
So I'm actually gonna do probably Pikes Peak again this summer. I'm heading out to Colorado with my nephew. We're gonna go to Air Force Academy and go visit School of the Mines in northern Colorado. But yeah, are you gonna be able to wake a Mattin boy up and get me a Mattin boy after this? I'm gonna cut our interview and then I'll begin with Zach and we'll get off camera and talk with him a little bit. Okay?
All right.
So,
Yeah, great.
hey man,
Thanks, Sam.
is there anything else you got for me before we cut this?
Thanks for what you do. I mean, obviously, you're great for the wrestling community, and we appreciate it. And trying to get this information out about what's going on, answer some simple questions, and I appreciate you.
Is there anything on COVID-19 that I didn't cover or didn't ask or something that I missed badly on that you can correct me on? Because I'm all right with that.
No, not at all. I think the last thing is, if your symptoms are mild, call your doctor's office. We want you to stay away, right? If you get sick and you need to come to the hospital, we're there for you. As testing becomes more available, I know we literally developed there's two drive-up testings now in Toledo area just through the ProMedica system, and which has been that's a big project to set up, and they did that very quickly, and it was very impressive. And they're starting to test people right from from home. The doctors write the order, they send them right through the drive-through testing, and the more availability we get to testing, the more that's going to expand, and it's going to be real helpful. But try to keep everything in perspective. We got a lot of good in this world. We're going to get through this. Just gotta again do the right things, hold each other accountable, and we're going to get through it.
Okay, Mike, thanks for the time. I'm going to cut this live interview. Okay.